Thank you very much for the kind introduction. Dr. Leila, excellent presentation. What you guys did is really kind of what I think we really want to replicate. So over the next couple of minutes, I'm going to talk about Punjab's progress towards elimination and kind of where we stand right now. My aims are going to be give you guys a quick overview of the enormity of the epidemic in Punjab, kind of the treatment efforts on the ground right now that are taking place, and the plans for scaling up testing and treatment. And I'm going to be focusing only on Hep C. As Dr. Huma Qureshi and others also mentioned, kind of the prevalence survey that was done in 2017 put Punjab really at the forefront for this epidemic. The overall national prevalence was 4.9%, Punjab was at 6.7%. 10 years later, in 2018, there was a provincial survey done, in Punjab by multiple stakeholders that actually showed an increase in prevalence from 6.9% to 8.9%. The survey was done by 3 different partners, so it was the Hepatitis Control Program, Pakistan Kidney and Liver Institute, and the Bureau of Statistics, Punjab. A 2-stage stratified sampling approach was used to kind of identify households. So a total of 4,800 households were in the sample size calculation, with 30,000 individuals in these households. We were able to access 95% of these households, and a total of 60%, participated in questions and blood samples. So if you look at the prevalence divided by age, you can see there is kind of an increase in prevalence in those less than 1 year of age. Detailed analysis actually shows that this is, persistence of mother Hep C antibody rather than an actual prevalence of Hep C viremia in these young kids who are less than 1 year. But if you see, the prevalence increases with age. So as you get older in Punjab, you are more at risk for having hepatitis C. So all the elderly people here from Punjab must get tested for hepatitis C. But what you kind of see is that there's a sudden jump. So after the age of 20, there's a significant increase in the prevalence. And I think what's happening is as you're progressing through community and healthcare facilities, you're kind of acquiring hepatitis C. And I think prevention has to be kind of at the center of everything. Punjab and Pakistan in general is a very young population. I think that's kind of what we're famous for internationally, that 40 to 50% of the population is actually young. So you can kind of see where we're going to go if we do not work now in Punjab, and we're going to really have an epidemic on our hands that we will not be able to control no matter what we do. If you talk about work in Punjab right now, I think at least in the public sector, I know there are a lot of private sector players as well, but at least in the public sector, there's the Hepatitis Control Program that is kind of taking a lead role. Pakistan Kidney and Liver Institute, which is public-private partnership, is also kind of playing its role. And the specialized healthcare is kind of assisting the Hepatitis Control Program, where referrals are made for their patients who have advanced cirrhosis and fibrosis. So these 3 different, key players are active right now. I'm going to share the Hep C treatment care cascade that you guys might have seen before, and this is for the Hepatitis Control Program in Punjab. So we were given funding by the government of Punjab from 2017 to 2019. We created 23 sites all across Punjab with a center in Lahore. Simplified testing, treatment guidelines, medical officers treating patients at these particular sites, but centralized testing. So all these tests were brought into the center Lahore. We, during these 2 years, were able to register somewhere 300,000 patients, and we put 60,000 patients on treatment. The Hepatitis Control Program, the program director and the assistant program director are sitting here, were kind enough to give me their data set. And so their Hepatitis Control Program numbers from 2016 up until now show that across 216 sites which are dedicated hepatitis C filter clinics, close to 3 million people have been screened, and close to 0.6 million people have actually been put on treatment. And SVR rates are around 92% for those people who return for SVR checks. There's a lot of challenges. I'm not going to talk about the success, because I think what we've shown is that you can push, decentralized sites and treat at these sites. But kind of what's needed in Punjab is that you need, if I'm correct at the numbers, Dr. Said, 400,000 patients need to be treated per year in Pakistan, and I think 70% of them need to be treated in Punjab. But we're treating only 100,000, and I think there are significant challenges, and the challenges are basically, money. If there's enough money, there's enough HR, there's enough resources that you can mobilize to kind of go through. But I think it's the budget that is one of the main things. We were given 1 billion. The hepatitis control program is also given 1 billion a year. And you really can't expect kind of the government sector to take ownership and treat all of these patients on their own. Some of the challenges that these sites had were that they lacked HR, but then what we and the hepatitis control program did was this training and task shifting, and there was nurse-led triaging. So like everybody said, there's no need for a doctor anymore to kind of be the frontline person for hep C testing, and a lot of this is being by a nurse, and maybe, people who are just trained, who are not really even medicine people, can be trained to perform hep C PCR tests, not PCR, but hep C point of care testing. I think that's something that we really need to look at when we talk about training HR. There were a lot of long wait times for hep C PCR, and so what happened at the hepatitis control program was that there was upgrade of lab services, but again, these were centralized lab services. In Punjab, we weren't able to decentralize lab services as of yet. That remains one of the biggest challenges. There's lack of treatment standardization, but at PKLIC, we created simplified testing and treatment guidelines, and the province also came up with provincial guidelines and protocols. So there were hep C provincial guidelines that were published and hep B provincial guidelines that were published that were followed by the hepatitis control program. Compliance in SVR12, I think internationally is also an issue, and was an issue over here as well. To overcome that, automated system-generated texts are being sent as reminders, and that's something that the program and we are working on. Reinfection is something that is not being documented, and I think is going to remain a challenge. Unless we come up with a smart strategy, I think this is something that will remain kind of a mystery in Pakistan. One of the strong strengths I think that Punjab has is that Punjab has a very strong information technology system. So PKLI had an EMR that was built by PITB at all these sites. And then primary and secondary health hepatitis control program also used PITB, but have now kind of transitioned into their home-grown program by the Health Information and Delivery Service Unit, which is called the HISDU. And as Dr. Leila Zubairi said, one of the significant challenges, I think she talked about electricity and internet. HISDU does appreciate that and offers services where data can be put in offline. And once the device is connected to the internet, all of this can kind of go to the central online system. So I think there are smart solutions coming out based on the challenges that people are facing. In August 2023, we did a national hepatitis elimination campaign conference in which the national program was launched, and I think public-private partners came in and worked towards a national way forward for Pakistan. And kind of what's happening is Punjab is that we're really looking towards working together with the center in pushing this forward. I think in the PC1 that Dr. Huma Qureshi kind of mentioned is that we want to screen patients who are above 12 years. In Punjab, the total population is 127 million. And so if you take out how many of them are above 12 years, 89 million people are actually above 12 years. So that's the population that we have to screen to find and cure hep C in Punjab. The question is, can Punjab do it? And the answer is yes. I think there's enough in Punjab where if we work together, if we're not just a vertical program, if we work horizontally across sites, we can do it. So I'm going to talk about not the private sector, but just kind of the public sector and what resources are at our disposal. So 26 DHQs, 131 THQs, 322 rural health centers, and 2,508 basic health units. So close to 3,000 facilities in Punjab at the present running, providing services. If we integrate them with hepatitis C, I think we're going to have less of a burden trying to train specific HR, and we can kind of just train HR all across. When you talk about, can we screen and then can we diagnose, do PCRs as well? And thanks to COVID, what has happened in Punjab is that, you don't have PCR capability only in the center now. So there's sites in Faisalabad, Gujranwala, Sargodha, Bahawalpur, Rawalpindi that have high through-output machines. And actually, Punjab now has a testing capacity of close to 5,000 per day for PCRs, which I think is pretty remarkable. That's not all Punjab has. A lot of gene experts. The thing is, these gene experts are with the TB control program, but present and can be utilized for Hep C as well if we work in collaboration and if we work in partnerships. So 36 districts and 171 gene expert machines currently available that in a day can give us 1,246 PCRs based on the different modules that they have in them. There's already upgradation of IT services that is happening, with the assistance of the Punjab Hepatitis Control Program and the HISDU. So, we want to utilize similar softwares all across the sites. The issue is PKLI has its own software. Some of the private companies have their own softwares. So what we're looking at is integration of data with not just private labs, but private partners as well. And that is something that HISDU has told us that is possible, if all private partners come together and tell us kind of exactly what they want. The HISDU network also has a huge call center. So they have 50 plus employees that are working 24/7, and can have a dedicated line for Hep C where patients can just call in and ask for guidance and be referred to kind of the most appropriate treatment facility if needed. This is kind of the last slide that I have, and I'm usually going to now end up with this is, we can't do this alone. Punjab in itself, the government can't do it alone. The private sector in Punjab can't do it alone. This is the National Point of Care Testing Program in Australia, an acknowledgement slide that one of the presenters presented. You see there's everybody coming together to make elimination possible in other countries. And I think that's what's needed here in Pakistan, specifically in Punjab as well. I think public-private partnership and integration of services is really the way forward. And I think we can really achieve our goals if we do that. Thank you. Last thing, I put in my email address over there. So if anybody is interested in collaboration, please do email.